Hi, everybody, and welcome to an amazing episode of Wellness Warriors. This is Dr. V, and on our podcast today, I have an amazing woman. Her name is Sue Macco. Is that pronounced properly?
Macco like taco.
Macco like taco. Very good. Well, Sue is a licensed registered nurse since 1979. So you and I have been at it for a long time. I graduated from chiropractic college in 1979.
Wow.
And for many years, she specialized in pediatric orthopedics, cardiac, thoracic, and neurosurgery, neonatal, ICU, and hemodialysis. But now what she's doing is very interesting to me. She's a certified digestive health specialist through the Loomis Institute of Enzyme Nutrition and a certified natural health professional. So Sue, I heard your story on an interview. I think it was with Chris Beat Cancer, and I was very intrigued by what you had to say about enzyme therapy and how you felt it was a benefit for you. So you are a two-time breast cancer conqueror. So tell us a little bit about your journey and how you ended up doing what you're doing now.
It's very interesting. The first time it was in 2007. And at the time, I didn't know about enzyme therapy, but I did go to Mexico for treatment because I felt like the treatment here was like cookie cutter. And it didn't sit well with me. Even though I'm a nurse, I was like, I can't do that. It just seems a little counterproductive. So I went to San Aviv in Mexico, and there I was introduced to an enzyme that they have a lot of people on, and it was only one enzyme. So after that, about a year after I came home, I got certified in natural health, and there was where I met an enzyme practitioner. And I had a problem with yeast, candida. I had a rash on my leg that I had when I was originally diagnosed. And then it came back. And the teacher said, cellulase kills candida on contact. And I'm like, I need cellulase, And she said, there's an enzyme practitioner in the audience, and you can go see her if you have a health issue. So I did go see her, and she put me on the program. The candida was gone in 2 weeks.
Wow.
And still at that event, I asked her questions, and she said, well, if you get someone else in your class and run them through the program and present them as a case study tonight in my room, I'll give you Dr. Loomis's book. And of course, I jumped at the chance, and I did that. And then the very next day, I opened an account with the company.
Very nice.
Yeah, and I just never looked back. And the lady that introduced me, she's in California, and she mentored me for 2 years. So it was quite extensive. And she encouraged me to take all the classes, which at the time I said, no, I don't want to take classes. But I took the first one, and then I was addicted.
Okay.
So then I did take all the classes and actually repeated a few of those because I felt like the physiology they present is different than what I actually had in nursing school.
Right.
So it's very, very intensive. So.
Now, you said when you went to Mexico, you went to San Aviv, and they gave you a pancreatic or an enzyme. I'm assuming it was a pancreatic enzyme, just like just a general pork enzyme.
Yes.
And how many enzymes were you taking a day?
Probably about 20.
Okay.
Not bad, but these were all enzymes that you take without food, because then they work on inflammation. Okay. That's the major difference between digestive enzymes and anti-inflammatory enzymes.
Okay.
Pancreatic enzymes are mostly anti-inflammatory.
Okay.
Because the pH is different. Plant enzymes offer a wider pH, so they work past an incompetent digestive system.
Excellent, and we need that.
Yes. So there is a difference between pancreatic and plant enzymes. That's
Okay.
with it.
So 2007, was that your first occurrence? And then what happened after that?
Yeah. Then after I started the enzyme program, I just was on their basic enzymes because at the time I didn't have cancer, right? So, but 7 or 8 years later, like 2014, our family had a real stressful event. And the same day that all of that came to head, I was diagnosed with stage 4 cancer. And so we really pay attention to the emotional component of healing now. And it's a big deal for us, big deal. And people say, well, you were on enzymes, how come you got cancer? And I say, well, I wasn't expecting to have a recurrence. And so I wasn't on a protocol. I was cancer-free for 7 or 8 years.
Mm-hmm.
So then I actually, in 2015, I saw another practitioner that does what I do. And he's been doing this for about 40 years. And he put me on a program, and it was pretty intense. And I did it for a year. And then once I had 2 PET scans that showed that the cancer was completely gone, that's when I cut down on my enzyme program.
Wow. So a stage 4
Mm-hmm.
to clean PET scan
Mm-hmm.
with very specified enzyme therapy. Now, what
Right.
else did you do on your journey during that time that you think helped you?
There are other supplements that I know kill cancer stem cells. For example, soul seeds. It's an essential fatty acid complex. It comes in a packet that you just squirt in your mouth.
Mm-hmm.
That was one thing that I did all the time. Colostrum was one thing I did all the time. A product called DDR Prime. It was studied by the University of Utah to kill cancer cells. And it's an essential oil complex. I have a link to all of these things on my website.
Okay.
Let me just see. Yeah. And then I did other essential oils in a capsule that I mix, like clove, because it's so powerful. I did those things too, in addition to my enzyme therapy. Plus, you know, you talk about nutrition and the role that it plays in recovery, and we juiced all the time, you know, so, and we have our own organic garden.
Wow,
So,
that's awesome.
Yeah. So it's, you know, we did a lot. I threw everything at it that I had, and it worked. And
Excellent.
actually, what I didn't mention is when I was diagnosed, it was August of 2015. In December, which is only 4 months later, is when I had my first PET scan, and it was almost completely gone.
Incredible.
But I have to tell my clients too, they can't, some of them can't expect the same results because I never had chemo and I never had radiation. So my cellular structure might have been a little different than theirs.
Right, right. Because we know that although those therapies or treatments may get rid of the superficial tumor, it doesn't really get to the root cause of what allowed the cancer to grow in the first place.
Yep.
So what does a nutritionist like you do when it comes to enzyme therapy? So you consult with clients all over, and you know, people can consult with you, and what's the process? Take me through the process. Although I've done the process with you, I want you to explain it.
We actually have clients in over a dozen states now and in 4 countries. And we are able to help them work through the process, you know, quite strategically, if you want to say it that way. It's really kind of cool. But what we do is a initial consult, and we determine whether or not the person thinks they can do the program, and whether or not we can really help them.
Mm-hmm.
So we do a free consult, and then they can actually sign up for a program, and we can drop ship the products to them. We can drop ship the urinalysis kit to them. There's an online survey that they can take, and then there's another PDF file. It's about 15 pages, and we send that to the client as well to fill out. It's more of like a health history with their medications and supplements and everything that we take a look at. Once we get all the data, we will schedule a 45-minute to an hour consult to review everything. And that's where we come up with a plan for them. Once we come up with a plan, we will drop ship the products to the client, and then we talk to them about 2 weeks after they are on the products. Then again, another 2 weeks after that, because we keep track very frequently at the beginning. Most of the hard part is done within the first 6 weeks. And then after that, if things are going well, then we space out the appointments to like once a month. And that goes on for about 6 months.
Okay, so the whole analysis is based on a urine test, correct?
Yes, and the survey.
And the survey. And
because,
so go ahead.
Because when a person tells us on the survey that their chief complaint is sleep issue or anxiety, we have to know that, because we have to fix that chief complaint or they don't think the program works. So we have to take care of the problem that we see on the urinalysis, but we also have to fix the issue that brought them to us. A lot of times people will say, I have cancer, I want it gone. But you can't see a measurable result unless they have testing like a PET scan or tumor markers. We have to have something tangible that we can see, like constipation, lessening of pain. We see those things most often with a cancer client, and we zero in on some of their symptoms that they have.
Okay, so what kinds of things can you determine from a urine test? I was very amazed at all the things that urine test told me. I was quite shocked, actually, because I thought I had a very healthy gut.
Yeah, well, the thing about gut health is most people don't know when there's things going on. And the urinalysis is different than a blood test, because by the time you have a blood test done, the damage is already there. With a urinalysis, the damage is occurring. That's the difference. So the urine test tells us the first part of it is a pathology screen, like they can do in every hospital. So we have diabetic patients that might be spilling glucose, that type of thing. And we can see that on their urinalysis. The rest of the urinalysis is very unique to what we do. And it's only done in 3 labs in the United States. And it tells us the indican level, which is how much toxicity is in the intestines. It can tell us if it's in the colon or the small intestine. That is one of my biggest concerns with a cancer client, because statistically, almost all of my clients have that. And that's the main thing we try and get rid of. And it's either, like for me, it was candida. That's in the small intestine, but the higher the number, that's in the colon itself. So we're very picky about what we have to treat people with the difference of the two.
So if somebody has bowel toxicity, they have a high indican level, then you would give them a specific enzyme to help clear that up.
Yes, and it's different than the one we use for candida, which is also considered bowel toxicity. So we can tell that. We can tell pH, and everybody's worried about their pH, right? Mm-hmm. We do not advocate for alkaline water, because many of our cancer clients have an alkaline pH because of that, and they feel horrible. We just, a balanced diet And, the enzymes are pH balanced too, but we don't advocate for making yourselves alkaline because we see other issues associated with that.
Yeah, I agree. Alkaline water really upsets the whole digestive tract because your stomach is acidic, and if you push too much alkalinity with
Right.
alkaline water, it can really affect, it's a cascading effect all the way down. So
Right. We can also see how much calcium, magnesium, we can check thyroid function, adrenal function, and these things all relate to the nutritional deficiency that we see on the test. So calcium and magnesium is highly indicative, how do you say it? Indicative. Of a thyroid abnormality, and we can see that on the urinalysis.
Interesting.
So, yeah. So we can see circulatory function. We have kidney function that shows up on there with the volume of urine that a person puts out compared to their specific gravity. An interesting thing, you can't find a lot of information on it. It's called the NPN urochrome, and that number indicates dehydration or the cells breaking down. And the sicker a person is, the higher that number is. And we can also see vitamin C levels. What else?
Candida, you mentioned.
Yeah.
Very good. Yeah, I was amazed at all the things that you told me based on the urinalysis.
Yep.
So I'm a big advocate of enzyme therapy, have always been since my initial journey in 2004. And for those of you who may not know, enzyme therapy is so important because if we take it back to the early 1900s, Dr. John Beard, who was an embryologist and studied cancer as well, recognized that the placenta was very similar to cancer cells. But what stopped the placenta from growing? Well, day 52, when the fetus starts producing pancreatic enzymes, that's when the placenta stopped growing. So he put two and two together. And since then, there's been many advocates of high dose enzyme therapy. So explain to our audience, how do the enzymes for the inflammation or the cancer work? What do they actually do when you take them on an empty stomach?
When you take an enzyme on an empty stomach, there's no food in the way. Then the enzymes are used throughout your whole body to fight the inflammation. They're like little Pac-Men, and they eat up bacteria, anything that would cause inflammation. They clean up toxins. They remove waste from your body. When you digest food, there's an importance about the digestive enzyme too. Even though it's not considered anti-inflammatory, most enzymes can be used as an anti-inflammatory enzyme if you take them on an empty stomach. But the enzymes that we recommend for digesting food helps to prevent the toxicity issue from happening in the first place. And that's the benefit of doing both at the same time.
Interesting.
So, there's a specific protocol that we have for cancer, and we use a digestive enzyme, and then we use another enzyme that helps to oxygenate the cell. And then we use the trauma enzyme.
The trauma enzymes.
To fight the inflammation. So the trauma enzyme is very popular, and it's been around for this protocol for a long time. Occasionally we have someone who needs something stronger. And when I was first diagnosed in 2015, I actually did not take trauma. I took what's called FARSP, F-A-R-S-P. And what that means is fever, abnormal motion, redness, swelling, and pain. The signs of inflammation, right? And so I was taking 4 of those 5 times a day. And I was going through a bottle every 9 days.
Wow.
And yeah, I did that for a year. And now I have 2 or 3 clients who are using that particular enzyme instead of trauma.
Okay.
because they really wanted to beef up their program. And we discussed that, because like it or not, we have to talk about finances and whether or not it's doable for them.
Sure.
So in cases where they can't, what we would have them do is take an extra dose of trauma instead. And most people have significant results with 1 or 2 extra doses of that, meaning they can take up to 6 doses per day.
Is it harmful if they take more?
Not really, no. I did have a client that decided to take measures into her own hands, and she was taking 10 Farsby at a time.
Wow.
The only thing we can see with something like that is they might get muscle cramps because there's so much protease. You have to balance it with calcium because protease carries calcium into the cell. If there's not enough calcium to provide, people will get muscle cramps. So that's really the only thing we worry about with enzymes, other than if people have an ulcer, they can't tolerate the trauma enzyme on their stomach lining until we heal it. And we have a specific enzyme that does that.
Interesting. Enzymes for everything.
We do, literally. It won't grow back a severed arm, but they do just about everything else.
So if somebody wanted to learn about this type of enzyme therapy, I mean, they have, they want to know what kind of enzyme they want to take or they should be taking. Is there a website they can go to? I know you have information on your website as well.
To learn about it, actually, I would say the best way to learn about what we specifically do with enzymes is to get Dr. Loomis's first book, and it's called Enzymes: The Key to Health.
Mm-hmm.
And he wrote that book long ago, and it's actually our first workbook, but it's written for many people to understand. And I'd highly recommend that.
Okay.
As far as websites, there's not a lot of websites that actually teach about enzyme therapy. We go to classes, and there's like 5 or 6 classes that we attend. And each one of those classes is Friday, Saturday, and Sunday. So when we're finished, we have like 500 or 600 hours of enzyme education.
Wow.
And there's a lot to know. And,
yeah.
Dr. Loomis is actually writing his most recent book, is coming out soon. And the name of it is, What is Your Deficiency? So people could actually read his book and actually discover what they're lacking. He writes so that people understand. He's very good at that.
Now he's probably what, 80 something?
He's 81.
And still going strong. And he's a chiropractor. That's why I love him.
And, he's not practicing anymore, but he's still teaching.
Sure.
He's still teaching us.
That's amazing.
Yeah.
That's great. That's great.
He takes his enzymes.
That's right. That's right.
Yeah.
So if somebody wanted to learn more about your program and perhaps, sign up and get some counseling or coaching with you, where would they go to get that?
They can give us a call. Our phone number is 920-884-3378, or they can email me at sue@nurseforhealth.com, or there's actually a link to email me on my website.
Okay.
We are also in the process of putting our calendar to schedule a free consult on the website.
That makes it so much easier.
Yep. I know that you do that. But my website is fairly new. It's only been active for about 6 months.
Wow.
And it happened like shortly before Chris aired my story. So we're happy with the timing. But we didn't get everything on there that we thought we would need. And
it's a work in progress.
Yep. So the calendar, my programmer already knows about it. And they're working on it right now.
Okay. Wonderful. Wonderful. And you have a special gift for our listeners. I'm so thankful and so excited about it. 10% off the program if they mention Dr. V, that they heard you on the podcast or through perhaps a blog or something that I've written about it. And you're going to offer that 10% discount through the end of November. So thank you so much for offering that.
Yes.
And do you have any parting words for our audience? If there was one thing that you would really see as a key to reversing and healing breast cancer, what would that be?
As far as digestion goes, because there's so many parameters, right?
Mm-hmm.
I would say because digestion plays a big role in healing. And the biggest thing I can say, and this is going to shock you, chew your food until it's liquid and then chew it some more. And
that's important because you get those amylase enzymes, right, in the saliva.
Exactly. Yeah. Exactly. See, you can do what I'm doing.
I'll let you take care of that. I've got too many other irons in the fire right now.
Yeah.
So that's great. That's good because we do eat too fast and we shovel in the food and we don't sit and, we're not conscious of our eating habits. So that's a good reminder. Yeah. Thank you.
Yeah.
Well, Sue, I'm so excited for you. I'm so proud of, your healing journey, what it's taught you. And I know with your program, you're going to help so many people. So thank you for all that you do.
Oh, I appreciate it. And thank you too. I really was sad that I couldn't attend your retreat, but maybe next year.
Next year. Yeah, you'll love it. It's a lot of fun. We had a great time. Yeah. All right. Thanks, Sue.
You're welcome. It was a pleasure. Thank you.